and I'd like to introduce our panel to you. The empty chair is for Congressman Dingle, who is on his way. He is chairman of the House Energy and Commerce Committee. Then we have from the administration, Mr. Ira Magaziner, who is domestic policy advisor to the Clinton administration and very much involved in the health care task force. With that, let's start with Mr. Magaziner.
Thank you. I'll wait till Chairman Dingle.
Here's Chairman Dingle. Thank you. Mr. Chairman, thank you for being with us. We've already introduced you.
Is Ira going to speak first?
Yeah, Ira's going to speak first. He's going to tell us what they plan to do, and you're going to tell us what you allow them to do, okay?
And I think
It sounds to me like you can skip my presentation.
Okay, Ira, go ahead with just a couple minutes, okay?
How long do I have to do that?
Not much time.
I guess.
I'll go ahead.
Yeah, Ira, go ahead.
I'd be happy if you led.
Okay. Can you all hear me? Is this thing on? The President, as you know, a number of weeks ago announced the formation of a task force chaired by the First Lady, Hillary Rodham Clinton, to come up with a comprehensive program for health care reform within 100 days. We will meet that deadline, and we will have a comprehensive plan that we will introduce to the Congress at that time. The President, in his State of the Union, for those of you who saw it, emphasized how strongly he feels about this issue. He believes that health care reform is fundamental, not just for the human reasons of the 37 million uninsured in this country and the countless others who are underinsured, but also for economic reasons, that the astronomical rise in health care costs that have been going on for a number of years and that are projected to go on into the future really wreak havoc on this economy. And so we need to do something that both provides insurance for those who are uninsured, provides security for all Americans who worry about losing their insurance, and also controls the growth in health care costs. The working groups that we've set up embody now over 400 people. We are working, I can assure you, day and night on this issue. And we are going through a very comprehensive process which builds upon work that has already been done by others. The reason why we believe it is possible to come up with a comprehensive plan in 100 days is because so much work has been done before us. I've had the, I was going to say pleasure, but I'll hold off that word. I've had the experience of having read 280 comprehensive health care reform reports that have been issued by different people over the 6 months since I've first entered into this arena. A lot of them are very good. The Congress has been working for years, Chairman Dingle and others, on this issue, and there is a tremendous amount of knowledge and a tremendous amount of prior work that has been done that we can build upon. And also the transition to this presidency did a tremendous amount of work. So that we're not trying to start from scratch here. We have a lot to build upon. And it's our feeling that we could debate this for another 10 years and still not be where we need to be. As Chairman Dingle is well aware, and others of you, when in 1936 the Social Security Act was passed in this country, there was every intention, as announced, of coming back and getting comprehensive health care reform in the next year. Here we stand now, many, many years later, and we still don't have it. Harry Truman proposed serious legislation for comprehensive health care reform. It was debated seriously, but we still don't have it. President Clinton believes that the time has come, that this year is the year in which comprehensive health care reform can be passed, and he's going to do everything in his power to try to bring it about. Now, there are a number of principles that he's laid out to us that should form the basis for our work, and I'll just run through those principles for you in the remaining time. First thing he has said is that we need to provide the American people with security vis-a-vis their health care. that they need to feel secure that if something happens to them, they can get care and that they are insured to get that care. Second thing is, he has said that we need to phase in the universal coverage of all Americans as soon as possible. The third thing he has said is that we must get cost growth under control. As is projected now, the growth in health care costs will eat up over 50% of the federal budget over the next 4 or 5 years and make it very difficult to hold down the deficit in the longer term. If we don't solve the health care problem, it's almost impossible in the longer term to solve the deficit problem. Similarly, health care costs, as they increase, and now going from almost 14% of GDP, are projected to go up to over 18% of GDP, and if we were to insure people, over 20% of GDP. If that happens, it eats up our living standard improvements over the rest of the decade. So we need to get costs under control. The fourth thing he has said is that he wants a system that is, as much as possible, providing personal choice for people, that people have the choice of what type of care to get, who their physician is going to be, and so on. He wants a system that is going to be private sector based and competitive as much as possible, not one where people in the healthcare industry become employees of the government, but rather where there is a private sector system with competition. He also wants a system that is going to aim towards maintaining high quality, not quality that is gained in the old-fashioned way by having checkers checking other checkers, checking other checkers, and a whole series of micromanaging enterprises, but rather quality that takes advantage of what we have learned in the total quality management movement over the past 15 or 20 years in industry. He also has said that he wants to reduce the bureaucracy in healthcare. As he went across the country during the campaign, over and over again, people would tell him tales of the paperwork and the bureaucracy that thwarted and frustrated them so. So he has put that down as a major principle that we should be guided by. He's also talked about the importance of making sure that underserved populations get served. It's not enough simply to give everybody some type of insurance card and say you're covered. That there are many people in rural areas of this country and also in poor urban areas who have needs that go beyond the normal provision of insurance, and that we need to make sure that any system we put in place takes consideration of the needs of that underserved population. So those are some of the kinds of principles around which we have talked. He has said that for those in this room that he is interested in a system that, broadly speaking, is a managed competition system, but within some discipline of a budget or a framework of a budget or some type of spending controls. That he hopes to get the best or harness the best of a competitive system, but also one that has the discipline to control cost growth. Now let me leave you with one final personal note on this. Before I came into government, which was, I guess, about 4 weeks ago, though it seems about 10 years ago, and I still really am learning the ways of Washington. It took us a number of weeks just to figure out how to get the phones to work and how to get people cleared in and out of our building and so on and so forth, things that are peculiar to working in the government. But before that, I was a small business person. I ran 2 successful small businesses. And in my consulting businesses, we had the kind of people working for us who generally would be considered good insurance risks for health insurance. Well-educated, generally young professionals. And yet we had to pay tremendous premiums over and above what a larger company would have to pay to insure our people. 30, 40% more. And in some cases, we would have difficulty getting certain insurers to accept us because we were small in size, even though we had a very stable record and were profitable and seemingly a very good population. As a small business person, and I know all of you are, or many of you are small business people, we need to solve this problem because it is hurting small business as much, if not more, than it's hurting almost anybody else in the economy. And we need to solve it in a way that is equitable across the whole economy. And so we will be very cognizant of the problems that small business has in this whole process. And I can assure you that if we can solve this problem this year, that the amount of money that will be freed up for the private sector in this country to invest will be greater by the end of this decade than almost anything else we can do in economic policy in this country. Because the sheer way in which healthcare cost increases have been eating up company profits, over 100% of after-tax profits of the whole corporate sector of the country last year was spent on healthcare. The way it's been eating up corporate profits, corporate money for investment, particularly for the small business sector, this burden has to be lifted, and we need to be able to solve this problem more efficiently. And we will always be keeping that in mind as we go about our business over the next couple of weeks.
Okay.
Thank you.
All right, thank you very much. We'd like to turn now to Congressman John Dingle, who is chairman of the House Energy and Commerce Committee. And Congressman, could you give us the view of this from Capitol Hill?
Well, I'm very excited to see that we have a president that finally wants to address great national problems which confront the country. After 12 years of having observed an administration that said no to everything, that seemed to know the cost of everything and the value of nothing, I rejoice at seeing that I have here a president who wants to lead in addressing the major problems like budget deficit and like addressing the problem of health care for all the people. For myself, I want to see a proposal enacted into law at the earliest time. I find nothing which is, to which I can take any exception with regard to what Mr. Magaziner has said. I will tell you this, I think that, that in my case, the tests of what is a good package is one which affords universal coverage, including the 37 million Americans who either are inadequately or totally uncovered, to see to it that we have a financing mechanism which ceases breaking business, large and small, which makes us uncompetitive in the world marketplace, and to see to it that we address the problem of cost containment and the problem of dealing with medical malpractice, which I see as another runaway evil which is afflicting our society. Having said those things, the undertaking upon which Mr. Magaziner and Mrs. Clinton are embarked is one of the most enormously difficult which I have ever seen during the time that I've had the privilege of serving in the Congress of the United States. And if they don't get the help of every American in resolving the twin problems of budget deficit and, quite honestly, health care, Americans are all going to have cause to seriously regret the failure of this society to do so. The benefits are enormous. Health care costs are going to double in less than 6 years. That means that the budget deficit of this country will have, instead of about $500 billion in Medicare and Medicaid costs, better than $1,000 billion or $1 trillion in costs that will have to be dealt with every year. Health care costs to the individual family are going to go from some $6,500 to $8,000 to something on the order of about $14,000 in the same period of time. The American industry now recognizes that they can no longer compete in the world marketplace when they carry the cost of a national health care system and when their competitors do not. It costs better than $1,000 a car, and lest you get the idea that that's a modest sum, let me inform you that the cost of health care makes Blue Cross and Blue Shield the largest single supplier of the American auto industry. And that cost is going to double in just a period of 6 years if we don't do something to address that particular problem. Having said those things, the situation can be addressed, I think. It is possible to be resolved. It is not something which any portion of the American society is not anxious to have addressed. I know no one who is satisfied with the health care system. It costs too much. It gives too little. It leaves too many uncovered. It is too unfair, too inefficient, and on top of that, it compounds all of this by simply being uneconomic, by making the American economy uncompetitive in the world marketplace, and it jeopardizes the well-being of each and every one of us. I used to talk about it as a matter of humanitarian concern. I no longer view it as a matter of humanitarian concern, although I must say, when I think about the Americans that are not getting adequate health care from prenatal until their deathbed, I am very much concerned. But the harsh fact of the matter is that it is now simply a matter of economic salvation to this country. And it is my hope that the President will be successful both in preparing his plan and in getting it up to the Congress. And it's also my hope that Americans will recognize that we can't anymore look each other in the eye and say, "Pardon me, dear friend, but your end of the lifeboat is sinking." Thank you.